If you live in glass house, you don't throw stones. What does that mean? And you want to break the glass now. Or if you are dealing with somebody that can't speak correctly, then soup, way sweet. I waiting class, you will not. So you also want to tell us whether this adult can use abstract reasoning. By the time you have interacted for like 5 minutes to 1 hour, you will know the level of intelligence of that child. But again, if you are not sure whether the person has average or below average, or then you go for an intelligent test, you send to go psychologist who will use the Wechsler intelligence test for children with very young. The enjoyment of the child, you also want to assess for judgment. And again, you ask some question. If you are in a field house, full, and there was fire, what would you do? Or this one, address every room on the floor. What would you do with it? So much once adult is listening with you well. So what do you do with your the result of the assessment? You will record the findings of the assessment in your register. And because you are spending some time with the child, you have formed a good rapport. That's why you are always nice. If you are nice with the child, he or she will come back to you. If you are judgmental and screaming and unfriendly, I don't want to see that auntie again. And of course, you now know the reasons, because we've had from the first speaker, there's denial. The mother will tell there's nothing wrong with my child. But you, as a facilitator, you have found out that there's problem with attention, with concentration, with memory, with orientation. You have found even 10 issues. Evident, prominently in the child. So you want to note what you have found and the reasons why the child referred to you. And of course, whether the child is motivated to undergo this kind of therapeutic training or not. Application results. Your therapy should not continue if the child has no motivation. Very severe, serious, profound stage that you know that you cannot assist. Or the client has no insight, is unaware, the mother is unaware, the child is unaware. Or sometimes the child will be on medication from the doctors, the tranquilizers that are sedating the child. The child may have some hearing or vision problem. I saw a child recently who could not go beyond primary 6 because they didn't know that the person had some visual problems. And we have seen quite a lot of children that go and stand in front of television. This is the screen now. Because they have long-sighted problem. And like, what are you doing there? Get out of that. Such a child will not see the board from when he's sitting. And then there's learning difficulty. Child is uncooperating with the facilitator. As we are talking to the child, he's running around the school. How the patient, we tell the student that patient enough. They even deal with such restless child. Or some children may have some physical or mental disorders that need to be corrected before they come back to you. What are the common characteristics shared by all dyslexics? They call dyslexics non-verbal thinkers. They cannot reason the way they read. So they use pictures to visualize what they are reading. So they think the mental images, they think the pictures of vivid imagination. Recognition perception process of the dyslexic child. We all use perception in space to survive. For example, as I'm walking along, my perception, my eyes are telling me there's something there, so I avoid it. There's something here. I'm hearing the siren. telling that something is passing by, or a gunshot nearby. So we don't perceive with the eyes, ears, to assist us in survival. But in dyslexics, disorientation of core is based as regards sight, hearing, balance, movement. Instead of them using the perception to survive, they get confused, big disturbance. When they're having this disorientation, there's shifting equilibrium, and they may have loss of balance. You see them staggering, and loss of coordination too. Time may appear to slow down for dyslexia. So the treatment or management of children is to correct these abnormal perceptions and resolve their confusion and disorientation. That's what we're trying to do here. For example, if a dyslexic child is reading, there is on the table, it gets to cat, and cat triggers disorientation. The sentence, there's a cat on the table, then there is then he sees ATC, or car, or tank. And the confusion and disorientation starts with that word cat, because he now sees 20 different ways of cat. So he stops, he reasons. There is a smart ones will jump the cat. There is a on the table. Intelligent ones. Not too intelligent, with low self-esteem and confidence. There is that. And as he's saying, there's a disorientation. He's seeing different things, perceptual disorders. Whatever the teacher is saying at that point in time, there's auditory disorders. So there's, again, loss of balance and coordination, which nobody will pick. One will say that you are so stupid. Sit down, next person go and read it. And this is the life of dyslexics. Or normal cats, he sees the cat upside down or inversely. Is it visual? And he's confused. And confusion will bring about panic, anxiety, fast heart rates, and of course making fun of the child. A child that cannot go will tell the parents that I don't want to go to school tomorrow. And that's the end of schooling. So like I said, the confusion can be visual, auditory, or kinesthetic. And that's the kind of psychological or emotional reactions of people with dyslexia. They become confused. They manifest with emotional reactions such as anxiety, panic. Even children at the age of 2, 3 will become depressed. But because they could not express themselves, even adults that are depressed, doctors can't pick them up. Not talk of children. Then the child adopts or creates his own coping strategies and behavioral changes to prevent future occurrences. Like I said, some smart ones will call the cats rats or mats or tag and read on. Some will jump it and read on. Some will have the anxiety and panic at that point in time and read on. But there will be some behavioral changes. And that's how some people can cope till they leave primary school and maybe enter secondary school. So the behavior of the child becomes compulsive, uncontrolled, reactive in an unconscious manner. Again, there's what we call a perceptual ability assessment. The purpose to teach the client how to create mental images because they think in pictures. So you want to reason along with the child in pictures. To consciously view mental images in 3 dimensions, to teach the client how to choose to take in pictures when they are having internal dialogue. Ask the child whether you are right-handed or left-handed. Ask the client whether he or she likes cake. If he says no, then ask what you like. Then you put the non-dominant hand like this, as if you are facing it. And you tell the client, I want you to close your eyes and visualize there's a cake on the left hand. You see, you want to teach the child how to visualize. And visualizers will immediately say, yes, I can see a cake. Say, what type of cake? Cheesecake, honey cake, whatever cake. Then take the finger of the dominant hand to the level of the nose like this, and tell the child, I want you to imagine the cake being on top of this finger, with the eyes closed. A visualizer will not have problem with that too. He will immediately tell, yes, I can see the cake on top of this finger. Then you move to the front of the face, can you see the cake? Yes, I can see it. Can you move it? Can you see the cake? I can see it. So you are actually assessing whether the child is a visualizer or not. So move the finger around and keep telling the child to move the mind's eye along with the cake. Pay attention to verbal response, the time, the speech duration of the child. And also note whether there's confusion or disorientation, because that's what you're looking for, while you are moving the finger around. Again, you are trying to assess whether the child is using what we call the mind's eye. What we all use regularly to imagine what we want. And after the exercise, you tell the child, that cake in your left hand, just make it go away. And you tell you it has gone out. Put an orange there. Can you see the orange? Again, make the orange go away. So you have done a perceptual ability assessment. Okay, this child is a visualizer. Results. A client can imagine the cake and control the movements of the mind's eye. That's a good candidate for your therapy. That means the child is able to benefit from. The client will learn to eliminate symptoms associated with that confusion, distortion, disorientation. And if he is able to master that process, then he will be free from symptoms of dyslexia. Gain sense of personal control over issues that had controlled him before now. And once he's able to do that, there will be increase in self-esteem, self-perception, and he will gain confidence in himself. And once a client can overcome his learning disabilities with this method, he can therefore go ahead and achieve. And that was what happened to all these names we have that are associated with dyslexia. Dancing, Disney, Alex Bell, Lennon. Again, step one, establish the dominant hand. Why do we always do that? If you're a right-handed person, the creativity will be on the left side of the brain. And if you're a left-handed person, your creativity will be on the right side. Explain that disorientation can occur when what the eyes or the ears, when the eye sees or the ears hear are altered. And balance also can be altered, and time can either slow down or speed up. And get a piece of paper to further draw out the process to be carried along, because again, you are very patient, so you want to write everything down, especially to be patient. Take by your hand that will go through your nose and out the back of your head like this. Imagination. Because you had determined earlier on whether the child is a visualizer or not, we are now going to step 2. Please imagine a line from this cake going through your nose and coming out the back of your head. That is line A. So, as simple as that, Somebody who is dyslexic can turn off that disorientation, can turn off confusion, can turn off panic and anxiety, just by imagining that that place has moved very back. So, disorientation, this is the normal orientation points as you are marking A, B, and C. But in during confusion, the point can move here, or can move there, or can move there. So just imagine yourself moving it back. And there's focus, there's orientation, and symptoms of dyslexia subside. If your mind's eye is always on that spot, the brain side that causes confusion is always switched off. Right and left, that can take 20 down over there. So we want to bring it to them. We don't know how to use it. If I put this microphone under someone's nose tube, I will hear. And we don't use. So you want to tell the child, look, one of the reasons you get confused because you don't learn how to relax. So you want to teach the child breathing sessions. How do you do it? Is you breathe into your abdomen and your lungs. Look at my tummy. As I'm breathing, it's getting bigger. Then I hold my breath for 5 seconds. Then I exhale through the mouth with a release. Now, can we all do one session? Everybody, breathe in slowly. Hold your breath. Out from the mouth. I've just released tension from the system. It's like I remove everything. Let us close our eyes, that our eyes closed. Breathe in slowly. Hold your breath. Out through the mouth. Just enjoy it. And let's do it again. Breathe in slowly. Hold your breath. Out through the mouth. Simple. With that exercise, you can remove tension from anybody. You think to the child that anytime you're feeling confused, dizzy, it's what you need to do. Adults, when you have the interview, before they call you, say, excuse me. You have presentation in front of 100 people. Before they use microphone, instead of going to the toilet, excuse me. So you use the control tension to control anxiety, to control panic. Some people use it to control headache. So children that are non-visualizers, you want to teach them how to quickly solve their confusion and irritation by learning how to breathe in deeply. And you can follow that up with what we call progressive muscular release. Now, as you are sitting down, enjoying your deep breath session, you want to add relaxation of muscles at the same time. And how do you do that? Again, can we sit upright with our eyes closed? Let's breathe in slowly. In. Hold your breath. Out with the mouth. Repeat after me slowly. I am relaxed. From my head to my toes. I am relaxed. From my toes to my head. I am relaxed. Every part of my body is
been acting